Here we have a sphygmomanometer. This is one of the most accurate machines you can use to estimate your blood pressure. It is more accurate because it uses which metal inside here? Mercury. So this is a mercury sphygmomanometer. It is much better than the digital sphygmomanometer or the aneroid sphygmomanometer. You know the aneroid one, the round one with like a little clock, the needle that goes like that. That has springs in it. The springs get rusted with time and they lose their accuracy, so we don't use that much. Otherwise you have to keep recalibrating it. Anyway, so this is your very accurate and nice machine, and we are using an indirect method of estimating blood pressure. That means we are going to put something on the body, okay, over the blood vessel, and we are going to measure the blood pressure in those vessels. If we want to do direct blood pressure estimation, I have to put some pressure sensor in the blood vessel, which we are not doing. We cannot do in our practice, okay? So this is an indirect method. Now, if you look at the sphygmomanometer, it has different parts. So, can anybody tell me what is this called? This is the cuff, the Rivarochi cuff. Very good, the Rivarochi cuff. In this, if you feel, there is a cloth of polyester type material, and if you feel, can you feel over here? There's something rubbery inside. Can you feel that? That is going to fill with air, because if you look at it, there's a hand pump over here, and this pump fills up this little balloon-like cuff, which is going to be on this vessel, and the same pressure is going to be transmitted to the mercury reservoir, okay? And we have one graded mercury manometer. These are the main parts of your sphygmomanometer over here. Now, there are two main techniques you're going to use to estimate blood pressure. Can anybody tell me those two techniques? Palpatory, excellent. Yes, using radial pulse, very good. Okay, you both were correct. What's the other technique? Auscultatory. So we hear something, so we use the stethoscope. Palpatory only gives you systolic blood pressure, and the auscultatory gives you systolic and diastolic blood pressure. So what is systolic blood pressure? No, what is systolic blood pressure? It is the maximum pressure in the vessels during the cardiac cycle, during systole. It happens during systole. And what is diastolic blood pressure? The lowest pressure in the vessels. It happens during ventricular diastole. Okay? Very easy. Now you're fine. So I'll just show you how we take blood pressure. Before we even take the blood pressure, we should make sure that our friend is relaxed over here. So, Aditya, are you relaxed? Yes. And you should build rapport with your patient. And you should see, he climbed up the stairs over here, so you have to tell him to relax for some 20 minutes over here. And then you see, I put him on this nice comfortable couch over here. We can watch TV and eat popcorn over here in this position. Why is that? Because I want his muscles to relax completely. If I put him on a metal chair, a cold metal chair without backrest, his back muscles will tense up, and that will increase his diastolic blood pressure. The blood vessels will squeeze in his muscles, causing increased peripheral resistance. So diastolic blood pressure will rise. False side even. And the metal chair will be cold when he sits. So suddenly his sympathetic nervous system will increase activity. So we make him sit on a comfortable chair. His back should be rested, and we make sure he has not exercised before he came over here or ran through the traffic and fought in the parking area. Now he's had a nice time, he's comfortable over here. And have you had any caffeine today? He has not had any coffee, tea, Red Bull, Monster, or any of those other high caffeinated beverages over here. Now, what we do is, we should remember that this mercury manometer must be at the level of his heart. So, if one of you can hold it just for our purpose over here. Now, I will do the palpatory method. I'm going to put this cuff on his brachial artery. And the rule is, you see this little hollow space? This is called your cubital fossa. You go 2 finger widths about it and put the cuff over there. Okay, this is an adult size cuff for an adult human being. Okay, children have smaller cuffs. You don't want a very big cuff and a very small cuff. For different age groups, there are different cuffs available. So, why do you want to keep the cuff at that correct size? If you have a very big cuff, you will have a false low reading. You will give false low blood pressure when he has high blood pressure. Then you don't treat him on time, and his heart starts to get stressed out, and he gets some hypertrophic cardiomyopathy, and he has an untimely death. And if you use small cuff, You have to squeeze a lot of air and you will have false high reading. Then put him on medicines which don't really help him. Okay? So he's comfortable. This is at the level of his heart. Thank you for holding it. And you be comfortable at it here. Okay? I'm feeling his radial pulse. Okay? Now I feel the pulse. Now I'm going to squeeze and make sure he does not see the manometer. He sees the numbers, he will get scared, not knowing what's going on. Now, the pulse has disappeared because the pressure has risen over here and it's reflected by this. I'm going to release this at the rate of 2 millimeters per second. Can you see how it's slowly going to? Oh, that was too fast, sorry. So we just release this at the rate of 2 millimeters per second. And eventually, you're going to feel the pulse. And the pulse came at 124 millimeters mercury. So we know that the systolic blood pressure is 124 millimeters mercury over here, okay? 124 millimeters mercury. If we want to get diastolic blood pressure, we use this auscultatory method, where we take this stethoscope, we put it over here. Now I know that his systolic was 124. You always do palpatory before auscultatory, okay? And you can go a little bit above that pressure. So 2 puffs above 124. So now I'm easily well above 124. And now I'm going to use the bell more than the diaphragm. People like to use diaphragm, I like to use bell because these are low-pitched sounds I'm going to get over here. And I'm going to release the air slowly at the rate of 2 millimeters per second. And then I'm going to wait to hear some sounds, and those sounds are called chronopulsions. I make you all hear it. So we release the air, and we could see that his blood pressure is 124 by 80 millimeters mercury by doing this. So this was the onset of the sounds, giving you systolic blood pressure, and the disappearance of the sounds, giving you diastolic blood pressure. Okay? Thank you.